This medication is used to relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. Guaifenesin belongs to a class of drugs known as expectorants. It works by thinning and loosening mucus in the airways, clearing congestion, and making breathing easier. Dextromethorphan belongs to a class of drugs known as cough suppressants. It acts on a part of the brain, cough center, to reduce the urge to cough. If you are self-treating with this medication, it is important to read the package instructions carefully before you start using this product to be sure it is right for you. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products, such as long-acting tablets/capsules, are not recommended for use in children younger than 12 years. Ask your doctor or pharmacist for more details about using your product safely. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not use this product to make a child sleepy. Do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier or saline nose drop/spray. When taking Scot-Tussin Senior, you can take it with or without food, as directed by your doctor. If you are self-treating, make sure to follow all the directions on the product package. And if you have any questions, don't hesitate to ask your doctor or pharmacist. It's important to drink plenty of fluids while taking this medication, as the fluids will help to break up mucus and clear congestion. The dosage of Scot-Tussin Senior is based on your age, medical condition, and how you respond to treatment. It's crucial not to increase your dose or take this drug more often than directed by your healthcare provider. If you are using the liquid form of this medication, make sure to carefully measure the dose using a special measuring device/spoon. Do not use a household spoon because it may not provide the correct dose. For powder packets, empty the entire contents of the packet onto your tongue and swallow. And if you are taking the capsule form, swallow the capsule whole. It's important to note that improper use of this medication, such as abuse, may result in serious harm like brain damage, seizure, or even death. So, make sure not to increase your dose, take it more often, or use it for a longer time than directed. And finally, if your cough returns, or if it is accompanied by a persistent headache, fever, severe sore throat, rash, or if it lasts or gets worse after 7 days, it's essential to inform your doctor. These may be signs of a serious medical problem, and you should seek medical help right away if you think you may have a serious medical problem. If you experience dizziness, drowsiness, nausea, or vomiting while taking Scot-Tussin Senior, it's important to let your doctor or pharmacist know. Your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. While rare, a serious allergic reaction to this drug is possible. Seek medical help immediately if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of potential side effects. If you experience any other effects, be sure to contact your doctor or pharmacist. As for the best time to take Scot-Tussin Senior, it's important to follow your doctor's instructions. They will provide you with the correct dosage and the optimal timing for taking this medication. Before using Scot-Tussin Senior, make sure to inform your doctor or pharmacist if you have any allergies to Guaifenesin or Dextromethorphan, or if you are allergic to any other inactive ingredients in the product. It's important to also let them know about your medical history, especially if you have any breathing problems, cough with blood or large amounts of mucus, or liver issues. This medication may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving, using machinery, or any activities that require alertness until you can do so safely. If you are using marijuana, make sure to talk to your doctor about it. The liquid forms and powder packets of Scot-Tussin Senior may contain sugar, alcohol, or aspartame, so if you have diabetes, liver disease, phenylketonuria, or any other condition that requires you to limit or avoid these substances, it's important to consult your doctor or pharmacist before using this medication. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, only use this medication when it is clearly needed and discuss the risks and benefits with your doctor. It is also important to consult your doctor before using Scot-Tussin Senior if you are breastfeeding, as it is unknown if Guaifenesin or Dextromethorphan passes into breast milk. It's important to be aware of potential drug interactions with Scot-Tussin Senior, as they can change how your medications work or increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking certain MAO inhibitors, such as isocarboxazid, metaxalone, methylene blue, and others, while using this medication, as it may cause a serious and possibly fatal drug interaction. Most MAO inhibitors should also not be taken for 2 weeks before treatment with this medication. It's important to ask your doctor when to start or stop taking this medication. Another product that may interact with Scot-Tussin Senior is rolapitant. Guaifenesin and Dextromethorphan, the active ingredients in Scot-Tussin Senior, are available in both prescription and non-prescription products. Be sure to check the labels of all your medications to make sure you are not taking more than one product containing Guaifenesin or Dextromethorphan. It's also important to note that Guaifenesin may interfere with certain lab tests, potentially causing false results. Make sure lab personnel and all your doctors are aware that you are using this drug. If you or someone you know has taken too much Scot-Tussin Senior and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. If your doctor has prescribed Scot-Tussin Senior for you, it's important not to share it with others. Make sure to attend all your medical and lab appointments as recommended by your healthcare provider. This will help ensure that you are getting the full benefit of this medication and that it is being properly monitored for your specific needs. If you happen to miss a dose of Scot-Tussin Senior, simply take it as soon as you remember. However, if it's already close to the time for your next dose, then it's best to just skip the missed dose and continue with your regular schedule. It's important that you do not take a double dose to make up for the missed one. When storing Scot-Tussin Senior, make sure to keep it at room temperature, away from light and moisture. It's best to avoid storing it in the bathroom and refrain from freezing the liquid forms of this medication. Different brands may have different storage needs, so it's important to check the product package for specific instructions or ask your pharmacist for guidance. Remember to keep all medications out of reach of children and pets. When it comes to disposing of this medication, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it expires or is no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal method. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.